Having spent more than 15 years studying nutrition and alternative medicine, and having witnessed many cases, I decided to share with you today some facts that may be shocking to some about turmeric. In short, I want to tell you about 6 side effects of turmeric that you should be aware of before including it in your diet. May cause diarrhea and nausea. First on our list is a rather uncomfortable truth about turmeric. Despite its myriad health benefits, it can ironically upset your digestive system. Consuming turmeric in large amounts may lead to gastrointestinal issues like diarrhea and nausea. Picture this. You're adding extra turmeric to your meals, thinking it's boosting your health, but instead, you find yourself running to the bathroom. This irony is due to turmeric's active compound, curcumin, which can irritate the digestive tract. Remember, even good things can have too much of a good effect. Interaction with medication. Turmeric's role in interacting with various medications is a critical aspect to consider. It can alter the effects of drugs, especially those used for diabetes and hypertension, leading to either heightened or diminished therapeutic effects. Picture turmeric as an unwelcome mediator in the delicate balance of medication management. For diabetic patients, turmeric's impact on blood sugar levels can interfere with insulin therapy, necessitating adjustments in dosage. Similarly, for hypertension, turmeric's blood pressure lowering effect can amplify the impact of antihypertensive drugs, potentially causing blood pressure to fall too low. It's essential for individuals on medication to discuss their turmeric intake with healthcare providers to ensure safe and effective treatment. This interaction underscores the importance of viewing turmeric not just as a simple kitchen spice, but as a potent agent that can significantly influence medical treatments. May be risky during surgery. We need to talk about turmeric and surgery. Due to its blood-thinning properties, turmeric can be a risk factor during surgical procedures. It's like having an unseen player in the operating room, affecting blood clotting without anyone realizing it. It's essential for anyone scheduled for surgery to inform their doctors about their turmeric intake, as it might necessitate a pause before the procedure. May increase risk of kidney stones. Moving on to a more stony concern, turmeric's role in kidney health is not all golden. High consumption of turmeric can lead to an increased risk of kidney stones. This happens because turmeric is high in soluble oxalates, which can bind to calcium and form insoluble calcium oxalate, a primary material of kidney stones. So, while you're thinking of fortifying your body with this golden spice, it might be silently laying the foundation for a painful kidney stone. Iron absorption inhibition. Turmeric's influence extends beyond just flavoring our food. It also interacts with how our body processes nutrients. A lesser-known fact about this golden spice is its ability to inhibit iron absorption. Imagine you're eating a nutrient-rich diet, but turmeric's presence is like a gatekeeper, limiting the amount of iron your body can absorb. This effect is particularly significant in individuals with borderline iron levels, or those prone to anemia. Turmeric contains compounds that bind with iron, reducing its bioavailability. For those who rely heavily on plant-based diets, where iron is already less readily absorbed, this could pose a serious health risk. It's a delicate balance. While we embrace the health benefits of turmeric, we must also be aware of its potential to hinder vital nutrient absorption. May cause gallbladder contractions. Turmeric's impact extends to the gallbladder too. In some people, it can stimulate the gallbladder to contract, which might sound beneficial. But for those with gallbladder disease, this can lead to severe pain and complications. It's like awakening a sleeping giant. What's meant to be a gentle nudge turns into a painful roar. This is a crucial consideration for anyone with gallbladder issues when reaching for that turmeric bottle. The effects can vary from person to person, so start with small amounts and monitor your body's reactions. If in doubt, consult your doctor for personalized advice. If you find this helpful, please subscribe and like.